LGBTQ youth as a whole have higher rates or higher risks associated with substance abuse, trauma, depression, anxiety, disordered eating, as well as suicidal ideation and suicide. And we also see a large chunk of our 1.6 million homeless youth in the United States that identify as LGBTQ. And there's many social factors involved in this: family rejection, discrimination, violence. And here's some commentary from the position statement from the American Academy of Pediatrics on youth gender affirming care, that our organizations strongly oppose legislation or regulation that would discriminate against gender diverse individuals, including children and adolescents, or limit access to comprehensive evidence-based care, which includes the provision of gender affirming care. And any discrimination based on gender identity or expression is damaging to social emotional health of children and families, as evidenced by increased risk of suicide. And so where does this land us in the terms of diagnosis and clinical care? So if an individual does meet criteria for gender dysphoria, gender affirming care is considered developmentally appropriate care. Again, we are orienting ourselves to understanding and appreciating that child's gender experience with the goal of reducing gender dysphoria over time and maximizing physical and psychological well-being for these kids and young adults. I see a lot of patients that are coming in because they're looking for more of a support or management of some of the co-occurring conditions with medical transition, or managing side effects of medical transition. I see a lot of patients too that are burned out from our conventional medical system. They're looking for other areas of support for their health, and particularly mental health. And so